Hi, so in this video we are going to discuss how to overcome insomnia. I'm going to focus on the cognitive behavioral therapy approach. This is a research-based approach that has been shown to be effective in overcoming insomnia that is related to many other different issues such as stress, chronic illness, and many others. So one of the best ways to approach insomnia is via a multifaceted approach because our sleep is a complex process. It's a biological process in our body, which is affected by both what we do physically during the day, as well as the state of our mind, and many other issues that we might be experiencing. And so this is why in order to overcome insomnia, it is good to do many different things simultaneously, so that to kind of target this complex issue of our sleep and the quality of our sleep. So this is why I want and I intend to make a series of several videos, because there are several things that we may want to do to overcome insomnia, and it may be difficult to implement them all at once. So ideally, you may want to take about 6 weeks, to dedicate 6 weeks to work on your sleep to make sure that you get better. Remember that cognitive behavioral therapy, one of the fundamental ideas of the cognitive behavioral therapy is that we can affect how we feel. We can affect certain processes in our lives and certain biological processes even in our body, such as sleep, by changing what we think and how we behave. So this is why cognitive, it stands for thinking, and behavioral, it stands for how we act. So by changing how we think about sleep and by changing how we act with respect to certain things that affect our sleep, we can improve our sleep. So by the way, a video about cognitive behavioral therapy is linked down below in case you wanted to find out a little bit more. So this is why in this video I'm going to talk about phase one for overcoming insomnia. And so this is a list of things that I think one might be able to implement within 1 to 2 weeks in order to be able to improve their sleep. This is not an entire list of all of the things, so other things are forthcoming in future videos. So phase one of overcoming insomnia. You all probably know that our intake of caffeine affects how well we sleep. So I wanted to provide a little bit more detailed information. So it is important to know that it takes about 6 hours for our body to disintegrate half of the caffeine that we have ingested. So it means that about 6 hours before we go to bed, if we have any difficulties with sleep, it is good to stop having any kind of caffeine about 6 hours before we go to bed. So that means if you go to bed at 10 p.m., then at 4 p.m. you should stop taking any kind of caffeine. So it's important to just actually calculate when is it that you want to be able to go to bed. To be honest, I err on a higher side, so I usually don't try not to drink any caffeinated drinks after lunchtime. Another thing about caffeine that is important is that sometimes we're not fully aware of many different ways that we take in caffeine during the day. So of course, caffeine is found in coffee, in black tea, and some other kinds of tea. Green tea also has a little bit of caffeine in it. It is also found in soda. That's where it is easy to miss it. But yes, most types of soda are caffeinated, and chocolate also contains caffeine. And so it's important to make sure that we are careful about how much caffeine we take during the day from all of these different types of foods and drinks. So another thing about caffeine is that 3 cups of caffeinated drinks per day is considered a moderate intake. 6 cups is considered excessive, as per the Sleep Foundation. So that's what I wanted to say about caffeine. So make sure that your caffeine intake does not interfere with your sleep. So within the next week, if you want to improve your sleep, take 1 week and make sure that you make that change. If necessary, you may want to make that change gradually. There are numerous studies that show that caffeine can be addictive, so you may want to taper down your caffeine intake. The next thing that you may want to do to improve your sleep is to get regular exercise. It is not recommended to have not rigorous. I'm saying that because I'm a mathematician. It is not recommended to do vigorous exercise activities 2 to 3 hours before your bedtime. However, a healthy amount of exercise is actually good for us because it helps us to get tired before the end of the day so that we actually feel sleepy. The next thing that is good to do is avoid heavy meals close to bedtime. So if I want to go to bed at 10 p.m., I shouldn't probably eat anything heavy later than 7 p.m. This is not any kind of attempt about food shaming. By all means, eat everything you like and everything you want. Just for the sake of your sleep, it's good to avoid any heavy meals 2 to 3 hours before bedtime. And one more thing that is important is to reduce the noise in the place where you sleep, to make sure that there is no light when you sleep, so that you have adequate blocking of light in case there is a lighting the street where you live on, if there is light outside. So there are various light blocking curtains that you can get for that purpose. Make sure that your mattress is comfortable for you, your bed linens and pillow, that all of these are comfortable. So these are, just to summarize, make sure you regulate your caffeine intake, no heavy meals before bedtime, make sure you exercise but not too close to bedtime, and make sure that actually your sleep environment is comfortable for you. It's not noisy, it's dark, it's comfortable, and it's cool. It's the temperature that you enjoy. It's actually recommended that it's cool. I are on the side of feeling warm. So as whatever it is that you choose for yourself, make sure you're comfortable. So this is the end of this video. I think it's enough of homework to do for 1 or 2 weeks. Not that I'm assigning you any homework, but if you do want to improve your sleep, you may consider doing these things. Since you have watched this video till the very end, I want to show you a bonus. I want to show you the duvets that people use in Ukraine, that they put on their blankets into. When I came into the United States, I was actually surprised by how the bed sheet is just a normal bed sheet, and then on top of that you would have a blanket, and then it would all be tucked in. That's not how I grew up, and that's not how people sleep in Ukraine, at least not at the time when I immigrated into the United States. So this is how a duvet in Ukraine would look like. I hope you can see. Yes. So there would be like this rhombus in the center, and so if this is your blanket, you would put the blanket inside that hole into that duvet, and that you would cover yourself by the whole thing, and then you never ever worry about your bed sheets and blankets becoming out of order So this has been a difficulty for me for adjusting into American culture. And in the United States, you can also buy duvets. I found that out, and that's what I do for myself. I thought that might be something fun and interesting for you to learn. I hope you have a nice day. I'll be making other videos about sleep hygiene and overcoming insomnia. So I hope to connect with you soon. Please subscribe, hit some thumbs up, and write comments if maybe you have some other ways of using bed sheets and bed linens and blankets. I'm curious to find out what they are. Have a nice day. Bye.